Okay, today we're going to be demonstrating trach suctioning and trach care. We're always going to perform trach suctioning before we perform trach care because we want to clean out that airway before we start irritating the airway and they cough up things on our clean dressing. So the first thing we're going to do is check our orders. And this patient has a tracheostomy tube, and we have an order to suction him every 2 hours and as needed, and to perform tracheostomy care daily and as needed. So I've checked my orders. I also looked to see if he had any allergies, and he does not. And then I gather my equipment. I'm going to need a tracheostomy suction kit, which has my suction catheter, sterile gloves, and saline. I'm going to need my tracheostomy care kit, and I will show you what's all in there when we do the trach care. I'm going to need personal protective equipment, gown and mask. I'm going to need a garbage receptacle. I'm going to need a pulse oximeter. I'm going to need an ambu bag, which should be in the patient's room. I'm going to need suction equipment, which should be in the patient's room. And I'm going to need my stethoscope, and I always have clean gloves available in the room if necessary. So I come into my patient's room. Good afternoon. How are you? You can just nod if you're okay. I understand that you can't answer me, so I'm going to be asking you questions in yes or no fashion. Is your name John Jones? Okay. Is your birthday 4/28/42? Okay, good. Are you allergic to latex, Mr. Jones? No? Okay. One other piece of equipment we need that I forgot is our towel. Okay. Are you allergic to anything else that you know of? No? All right. I'm here to suction out your catheter in your neck, your tracheostomy. And I know that's uncomfortable for you. If at any time you need me to stop, I want you to raise your hand and let me know. I will be getting you ready in just a minute. First thing I want to do is listen to your lungs, okay? So I'm going to raise you up to an upright position. We know our tracheostomy patients can't go below 30 degrees anyway, but we want them in an upright position if possible for this suctioning. And then I would perform a respiratory assessment, and I can put my stethoscope to the side after I have performed that. We want a baseline assessment. Then I'm going to prepare my equipment. I'm going to put on my protective equipment. First, let's go ahead and get a pulse oximeter reading and let it be reading, because we want to monitor their O2 sat the whole time, because we are depleting their oxygen supply, and we want to make sure that it is appropriate. And we know normal is 95 to 100. Okay, we're going to cover our patient with a towel just so we don't get any secretions on them. I'm going to let this rail down. Okay, and then I'm going to put on my protective equipment. I'm going to put on our isolation gown, or our fluid resistant gown. When we suction these patients, they tend to cough. And the coughing, they don't cough anything up out of their mouth, they cough it up through their trach. And we don't want to get splattered with that. So, we're going to put this on. And then we're going to put on, and it may be hard for you to hear me, so bear with me, our fluid shield mask. Now we have that on, and we're ready to get our suction set up. We want our suction set between 100 to 120, and we want it on continuous for this. We will make it intermittent with our thumb on the suction valve. And we want to go ahead and bring our suction tubing over the head of the bed so that we can grab it one-handed when we're ready. We also want our oxygen connected to our ambu bag when we get ready for that. But that's the last thing we want to do because we want to keep them oxygenated. So let's go ahead and have our garbage receptacle. We're going to get rid of this because we don't need it right now. This would be tied. Okay, now the last thing I'm going to do is change over my oxygen supply from my tracheostomy collar to my ambu bag. So it's going to be attached to this, and we're going to increase it to 100%. This is one of the only 2 times you can adjust this without a physician's order. Okay, and we're going to have it where we can get to it one-handed. So now, since they're not getting any oxygen through this, we're going to remove it. And to make it a little bit easier, if the patient can tolerate it, we're going to remove their pillow. And now we're going to set up our equipment fairly rapidly. Hand hygiene. Okay, so we're going to open away from us. In this, you have a pair of sterile gloves. You pinch those out first, and you put those on. Okay. This is not working well. There we go. Good. Okay, our saline is in a container. It has not been used, so we don't have to lip it. We take the cap off, we put it down in our garbage. Remember, we toss things in the garbage, and it has a little holder right there. We take this out, toss it. This we want to contain. We want the end that goes down the suction catheter, or down the tracheostomy, between our pinky and our ring finger, and we wrap it around all of our fingers to wind up with the suction valve between our thumb and forefinger. Now we're ready to contaminate our non-dominant hand by connecting the suction catheter to our suction tubing. Okay, now what we're going to do is we are going to test our suction catheter and lubricate it. So we're going to put our thumb on the valve, which applies the suction. That lubricates it and tests it. Then we're going to wrap it back up so we can contain it. Now at this time, I do not want to get any closer than an inch or two from that valve because it's contaminated. Now we want to hyperoxygenate our patient. 5 breaths that mimic regular breaths. 1, 2, 3, 4, 5. Okay, now we're ready to suction. Again, we can only hold here, holding this like a pencil, keeping it taut. My gown is falling off, I apologize. We're going to go down, touching only the inner part of that tracheostomy with no suction on. Feed it through until you meet resistance or they act like they're coughing. Then we're going to do 3 things. We're going to rotate the catheter, we're going to apply intermittent suction, and we're going to withdraw it. And this should take no longer than 10 to 15 seconds, and we want to contain it. And you wrap it up right quick, and you give them 3 breaths. Okay, our O2 sat is 95, so we're good. Now, my gown is falling off, but we're going to let the patient rest a minute, and we're going to clean this catheter out. We have to wait a minute between passes. And if we need to make more passes, we can. We can do a total of 3 through the tracheostomy. But if they're clear after that first pass, then you're good. So we're going to say that they're not coughing up anything else and they're clear. So now what we would do, instead of 3 breaths at that time, this would have been 5. So we would do 1, 2, 3, 4, 5. At that point, we're going to take our contaminated hand, take off our old dressing, remove it, disconnect our suction catheter from our tubing, and we're going to roll it up in our glove. And we're going to replace their oxygen with the trach collar and swap out our oxygen delivery from our ambu bag to our trach collar. But we're going to leave it at 100%.